Good morning, everyone. All of us are seeing a surge of non-communicable diseases, the diseases which are rooted in our lifestyle. And as clinicians, we always feel a bit frustrated, along with the patients and their families, that these are chronic, multifactorial conditions which you have to deal with. It's not like a bacterial infection or viral infection and you give a 6 days antibiotic and you say, ab aap theek ho gaye ho, ab aapko aane ki zarurat nahi hai. This is something that really drains people, mentally, emotionally, financially, socially. What better to know than a dermatologist, where all of these conditions, autoimmune, allergic, and hormonal, they come on the skin. And every other person whom you meet is then the same doctor for you. Socially, you want to hide. So when I started the lifestyle medicine, I came to know about it, that I can integrate it in. And I started doing it like 6 years back. The results were tremendous. So tremendous, just like all of us in the PAN, that it was very difficult for us to not talk about it, to tell it to the people around. This, the heartening people that they are there, the audience that are there, who believe in lifestyle medicine. This reminds me of the poem with which will I begin my talk for today by रामधारी सिंह दिनकर राष्ट्र कवि. सच है विपत्ति जब आती है, कायर को ही दहलाती है, शूर माँ नहीं विचलित होते, पल एक नहीं धीरज खोते, विघ्नों को गले लगाते हैं, कांटों में भी राह बनाते हैं, है कौन विघ्न ऐसा जग में. टिक सके वीर नर के मग में, हम ठोक ठेलता है जब नर पर्वत के जाते पांव उखड़, मानव जब जोर लगाता है पत्थर पानी बन जाता है, मानव जब जोर लगाता है पत्थर पानी बन जाता है. Myself, Dr. Smriti Naswa. So globally, we are seeing that the NCDs are taking up the cause of the deaths over the communicable diseases. India is not lagging behind. It's soon becoming the diabetic capital of India. And it is not that it's an old age disease anymore. It is being dealt with across the ages, including the children who are the future citizens of the world. This is the health of the states of India in 1990, when the communicable maternal health diseases were the ones that were ruining us. Now in 2016, 61.8% is being taken in by the non-communicable diseases. Cancer is projected to rise by the 57.5% by 2040, and we all alike really get scared with that name. So higher expenditure is there across the states in India. There is a very peculiar case when it comes to the genetics of the Indians. Like people say, you know, we are not Western and this and that, but when we start following this affluent, rich class, westernized lifestyle, we have to understand that diabetics happen more common and at an earlier age in India. That's why for Indians, less than 23 BMI is recommended rather than less than 25. CAD is more common, and alcohol dependence also is more common. They said that we are genetically predisposed to all these lifestyle diseases. So, are we doomed? Now that you have genetics, you have a family history, okay, you have to accept that by some age, you will have to have these diseases, accept kar lo. The answer is something there lies in the word called as epigenetics. So we have environmental options like nutrition, stress, toxicants, pathogens. All these things impact something called as epigenetics. Till now, they were called as junk genes. Well, like, there is no use of it. But now the data is clear, the understanding is clear, that the epigenetics have a role to play on the genes. So the regulation of the genes and the phenotypic changes, whether it will actually happen, depends on the epigenetics. So Dr. Esselstyn, one of the pioneers of nutrition prescription around the world, a cardiologist, gave a beautiful line: genetics load the gun, lifestyle pulls the trigger. You can have a loaded gun for life. You need not manifest it. This was a very remarkable study in 1993 published in JAMA, where actual deaths causes were found out in US. And interestingly, 4 of them, tobacco, poor diet, physical activity, alcohol consumption, and illicit drug use were out of that, which actually were amounting to 40% of the 50% of the actual causes were in modified risk factors. These are the rooted in your behavioral choices. So basically, what is lifestyle medicine? It uses therapeutic lifestyle interventions as primary modality, not as the additional, that, I've given you the medicines, now you go to the dietitian, now you go exercise, now you work on your sleep. This becomes the primary modality. And what it does is applies evidence-based, whole person prescriptive lifestyle change to prevent, treat, and reverse such conditions. This line is important, that we are working on primary prevention, secondary prevention, as well as tertiary prevention of these diseases. They address the root cause. We are now shifting from managing the diseases to healing the whole humans. So, is lifestyle medicine different from conventional medicine? No. Lifestyle medicine is actually the foundation of conventional medicine. Conventional practice guidelines for chronic diseases become the support system for the lifestyle medicine, which are the first line of management now before medication. We start prescribing the lifestyle changes in a proper prescription format. What are the pillars of lifestyle medicine? So the 40% modifiable behavioral factor which you saw, they come into these 6 pillars: nutrition, exercise, sleep, stress, substance abuse, and healthy relationship. So this was the study. We found a hypothesis, and now we go on to prove it. It's being proven for more than 50, 60 years across the world, and innumerable publications have happened with robust methodology. I will only talk with one. One of the pioneers, Dr. Dean Ornish, his Ornish diet is charting top 10 for last couple of decades in the US. He's a cardiologist. He's actually a preventive cardiologist since 1970s working in California. His book is something that we should all read, not for our patients, but ourselves as well. So what they did was, they started something called as Lifestyle Heart Trial. It was actually a prospective study, an RCT, a very robust method of 1, 2, or 3 vessel disease, not on any statins, and they had 2 groups, standard care and intensive lifestyle change care. So the standard care was given the way that it is usually followed, but intensive lifestyle, they were given 10% fat, whole foods, vegetarian diet with aerobic exercise, stress management training was given, group support system was there, smoking cessation, and psychological support as well. The answers and the results were tremendous. The average percentage of stenosis in the standard care group increased from baseline 41.3 to 42.3% in 1 year and 51.9. There was a 27.7% worsening at 5 years of age. But what was really heartening was that in the intensive lifestyle change, the average percent stenosis actually decreased. It not only decreased for 1 year, the decrease continued for 5 years without statins. 7.9% improvement was seen. This was a beautiful photograph that was published by Dr. Esselstyn on how a plant-based diet is working on shrinking of the plaque. We do not wait for the last moment of the MI. We start working on shrinking of the plaque. Then Dr. Dean Ornish and his team went ahead. He was a cardiologist, but this did not stop him. So he went ahead to work on whole food, minimally processed plant-based diet, high in complex carbohydrates, low in harmful fats. And believe me, the last line is absolutely important. It was unrestricted calories. No portion control whatsoever. No thinking about where will I get my protein or carbohydrate. All you knew that your plate has to look like whole plant-based. He worked on the germinal study where carcinoma prostate genes, the genes which were causing it were getting down-regulated and 453 genes were up-regulated, telomere lengthening was happening. This is the reason for aging, right? Telomere shortening. So telomere lengthening was proved, and recently in Jan 2024, last year, they published how cognitive impairment and early dementia is being prevented and reversed in neurodegenerative disorders of dementia, Parkinson's, the problems of the elderly. This was not all. There were multiple more studies, robust methodology, long-term, 30, 40, 50, 60 years, and still continuing prospective studies with follow-ups like EPIC Oxford, PREDIMED, Adventist, Nurses Health Study, Freedom from Diabetes is the study of our own Dr. Pramod Tripathi. He has been working for more than a decade on this. These are the doctors who have been the pioneers of bringing nutrition prescription. They have their websites, they have their books published, they have everything. But what is very important, they all did it for themselves first. They saw the change, and then it was so drastic that they wanted to implement it on their patients. So here comes the question. What is the statistical analysis for us, Indian physicians? Are we the health epitome? We are the health people of the country, and 20% are obese, 53% have diabetes, 24% are hypertensive. It really, it saddens all of us when our own colleague has to go through all these things. So physician burnout, that was a study published, it told that 93% of us feel stress and burnout, 69%, especially during the COVID era, were feeling depression, 13% were even contemplating suicide because the routine medical management just wasn't giving the answers. So how can 6 pillars of LM help the doctors? They can help their own health. It's proven that surgeons who regularly exercise have less burnout. They spend time with their families and talk about their feelings. They're happier, right? And the second thing is that those are prescribing lifestyle medicine to their patient, 90% reported that LM positively impacted their own medical satisfaction. In last 6 years, I really feel happy to go to the OPD. I said, bring it on, let us figure out your cause and we will work on it. After 6 months, we can make you your own doctors. So doctors are the role models of their patients. The answer is practice what you preach. It's said that those who exercise are likely to counsel more on exercising. Those who are having 2 to 3 fruits, 4 to 5 vegetables every day are likely to counsel more on nutrition. Those who themselves eat less fat are likely to even counsel and test for cholesterols. Poor physician health habits affect the counseling skills also. If your patient is not listening to you, probably you have to start practicing what you are preaching. This is Dr. Davis Sabgir. He's a cardiologist, he wanted people to walk. So he started something, Walk with Doc. He started consulting while walking. And that has become such a big thing in Ohio. So these are the pillars of nutrition, social connectedness, mental health, and exercise that we can embark in our own journey. Coming to the 6 pillars, in very, very short, we will be detailing it throughout the course of the CME. So this was a beautiful study in 2017 on the dietary factors. See, what we usually tell as doctors, we said, you decrease your high processed meats and red meats and your risks of the diet-related deaths will reduce. But it is coming so low in the spectrum. This is not the more important part. The most important, then we go for high trans fat and high sugar drinks. We all know processed foods are bad, packaged foods are bad, so we do not want that. But what is the bigger chunk out there? This is quite low in that chunk. The bigger chunk is less whole grains, less foods, less nuts and seeds, vegetables. So if you see that 7 out of 10 of these are actually the lack of whole food plant-based. What are we eating today? This. And what is missing? What is the most deficient nutrient in the world right now? Fiber. What is fiber? Why is fiber important? We all have heard about the mechanism of action of leaky gut syndrome out here. It's a food for gut bacteria. We also call it prebiotics. So fiber is the food for gut bacteria. The fiber is present in the leafy greens, vegetables, fruits, legumes, sprouts, whole grains, seeds, and nuts. And it is not present in meat and chicken, in fish and eggs, in milk and milk products, in oils, refined foods, processed foods, ultra-processed foods. So what are whole plant foods? What's the definition? The whole plant foods name was brought in by Dr. Professor Colin Campbell, the landmark study of China study that everyone should read. It's the Bible. He brought in the word called as whole. So basically, if we come for carbohydrates, not all carbs are same. So when it comes to these complex carbohydrates, there is no need for any portion control. When it comes to protein, this is whole that is processed. When it comes to oils, this is left is oils, which we put in lots of fried food and packaged foods, but nuts and seeds are actually, they compete with the cholesterol and they decrease that. So American College of Lifestyle Medicine listened, and they have now formed a full thing. We are now the graduates of IBLM. This is the plate that has been now recommended. It's now recommended in the ICMR 2024 also. 50% of your plate should look like the colorful fruits and vegetables, 25% whole complex grains, and 25% of the proteins and the fats. This is the same with US Dietary Association. This is the same with Canada. In fact, Canada says make water as your drink of choice. So then people say, okay, fine, you know, what happens is I have this knee problem, so I'm not able to exercise, so that's why I'm not able to lose weight. Or sometimes they say, I've had my chole bhature, let me burn it out. Do you do that? You cannot outrun a bad diet. So diet remains the basic. You have to run for around half a marathon to just burn that one mac cheese aloo tikki burger. So calorie counting and portion needed, is it actually needed? You have to remember this thing, that when this 500 calories look like this. When you have the oil and the cheese and the meat, you still feel that you have lots of space for lots of food. But when you have the fruits and the vegetables, and then the potatoes, rice and beans, your stomach is full. You just cannot overeat on a plant-based diet. You get full so soon. This is how the 450 calorie look like. 2 banana chips, your 40 drops of oils are drawn there. So this is how we want the people to shift from calorie dense to nutrient dense. 2 vada pav are equivalent into the calorie of that 3 plates out there. Who can eat those 3 plates in one go? But that 2 vada pav can always come in your sham ka bhajia. But you know what? The tongue to manta hi nahi hai. This is so boring. This is like, I just cannot eat those salads. I just don't like the look of it. Okay, just change the look of them. We can go for smoothies. We can go for whole plant-based. These cakes, I allow my kids to have like full as their own meal, half a kilo you finish, I'm fine, because I'm just putting lots of jawar and coconut milk and jaggery with no butters and everything in that. And similarly, we shift to the Nimbu Pani, the Kokum Sharbat and the Nariyal Pani instead of those sugar-sweetened beverages. These are some snacks of my own home. And so basically the current Indian plate looks like this, you know, bahut sare chawal, bahut sari roti. We are not athletes or farmers anymore. We are sedentary people. We have to shift to that kind of the plate, which is 50% of the fruits and the vegetables. This is a lunch plate, so you're not seeing a fruit there. And you know why are so many athletes shifting it to this? They are shifting because of the longevity and quick recovery. The lifestyle, so with this, I go to the second, which is the lifestyle pillar. Nahi chal raha. Exercise. Chalega. So, you know, globally 78% do not meet the guidelines. They're just not meeting the guidelines. 75% adolescents are not meeting the guidelines. This is the problem with that. The third lifestyle pillar is sleep. I will only talk about these 2 words called as melatonin and cortisol. People say, मैं 8 घंटे सोता हूँ रात को 1 बजे से सुबह 9 बजे तक. It's not working, because then at night you are liberating cortisol. When you're supposed to repair, you're actually secreting steroids. The steroid wants you to sleep by 10 so that your melatonin starts working on the repair process, and then you wake up by 7 or before that. That way you will have long, dark, beautiful hair also. The early graying that we are seeing nowadays, it's because of late night routines. Circadian rhythm, the best work was done by Dr. Yoshinori Oshumi, who got the Nobel Prize for intermittent fasting. And now it is proven that when we do intermittent fasting based on circadian rhythm of sunrise-sunset cycle, it works beautifully. Insulin sensitivity, autophagy, reversing of cancers and autoimmune diseases. This is working well. The next pillar is stress. Dr. King Lee, he's from Japan. They were trying to work in 1980 on conserving the forests. And they found out that the Shinrin-yoku, when they brought in the chemicals from the trees and they put it in their ICUs, suddenly the nurses who are dealing with the cases which are really where their work stress levels shifted from 41% to 3%. They said that I can handle difficult situation from 13% to 58%. So walking in a gym, walking in a parking do work, but when you walk among the trees, that is a different aspect to it. So did you know that good food, good mood? You really do not want to need to deal with anxieties and depression because this fiber in the gut bacteria is actually liberating the serotonin, the calming neurotransmitter in us. The fifth is substance abuse. We all talk about smoking mat karo, alcohol mat piyo, no drugs. Yes, but what is the problem today is digital addiction. Digital addiction they say that problematic social media use is taking up the young adults with depression, and especially if they have the nighttime usage, that causes low esteem, anxiety, and poor sleep. And then there is an addiction of sugars and the salts and the whites and the refines. And it is not only for the kids, by the way, it's for our grandparent generation. This was among the age of 50 to 80, the 44% were showing the symptoms of addiction for those salts and the sugars and the refined foods. What's the second problem? When you eat a Marie biscuit, you're also eating these many products. What's the problem with these additives? Of course, they are not natural foods. They also are addictive. They cause headaches, ADHD, obesity, endocrine disruption, carcinogens, neurological and cardiovascular complications. Free mein with us. And last, most important, the lifestyle pillar, what beautiful than the blue zones diet. They found out that these people are just everyone was a centenarian. 100 would be younger for them. 120 is such a common thing for them. And they found the power 9 where it was a social connectedness. The time taken away from the technology towards the real meaningful connections. And they actually also saw that their diets were 95 to 100% plant-based diet, along with the other pillars of movements and all those things. I will end my talk by saying, Yukta hara viharasya, yukta cheshtasya karmasu, yukta swapnava bodhasya, yogo bhavati dukhaha. Even Gita tells us to follow all those pillars, then the yoga system will take care of your health. Coming to the prize alert. So when this comes throughout the day, there are some prizes for the audience who gives the right answer. It would be better if you just raise your hand and then that would give you a fair chance for the answer. The question is, forest bathing or Shinrin-yoku, which I told. Okay, sir, you have already raised your hand. You can tell. Yes. Fight on sides. Wonderful. Great. So basically the trees, they liberate fight on sides they increase the natural killer cell activity, enhance your innate immunity, decrease cortisol, and that's why alleviate anxiety and improve anti-cancer properties. The second question is okay, I'm so sorry. You can stand. Right. So I'll give you the chance because you're not able to see. Under physical activity guidelines for Americans, what is the current minimum activity suggested by the experts? 150. You, ma'am? Okay, sir? 150. 150. Anybody else other than 150? Any amount of activity or exercise per day is beneficial. D is the right answer. We all think it's 150. We have realized we are not reaching there. So they know that we are not moving. Earlier it was 10 minutes. Now they have hill lo apni jagah se. That is also fine. Thank you so much.